All right, everyone, I think I'm going to get started and folks can just continue to roll in as we go. But I know that we're on a bit of a time crunch, so we're going to get started so we don't go over time. So first things first, I just want to take a moment to introduce you to our webinar, From Wastewater Monitoring to Point of Care Testing, Bridging Technology and Healthcare to Empower Community Health Outcomes. Before getting started, I want to acknowledge that the One Yukon Coalition and our offices operate on the traditional territories of the Quachin Council and the Kwanlin First Nations. These lands, rich with the history and traditions of the Tagish Kwan people, have nurtured their communities since ancient times. We recognize and respect their profound and enduring connection to this land, its waters, and its resources, which continue to enrich our sense of place and community. As we start, I have a couple housekeeping items. First of all, if anyone has never attended a webinar before, there is a Q&A option located at the bottom of your Zoom window. If you type your questions there, we'll be able to address them during the Q&A time at the end of the presentation. There's also a number of One Yukon members present who may be able to provide some context to your questions as the presentation goes on. I believe there's also an upvote option, so if there's a question that resonates with you, you can upvote it so it goes to the top of the queue. This webinar is also being recorded, which will allow for viewing after this initial session is completed, and the feedback link will be available on our website and will be emailed to all registered participants. With all that covered, you can see that we have a full docket of material today. We'll be taking time to discuss our organization's background, our current wastewater monitoring program and the technologies we use, our reporting pathways, substance use and abuse in the territory, STBBIs, point of care testing, and community engagement with the opportunity for questions. Knowing our agenda, I've highlighted a few objectives. First, we hope to provide a clear introduction to One Yukon, our programs, goals, and our role in health promotion, and fit for all of our stakeholders. Next, provide insight into the process of wastewater monitoring and its role in empowering communities. Thirdly, highlight the role of technology integration with effective reporting to close the data gap. And lastly, to amplify the importance of community engagement and outreach to address public health outcomes. Keeping in mind these objectives, it's my pleasure to introduce our first speaker, Mathia Alatini, One Yukon CEO and Interim Board Chair. Mathia is an advocate for health and unity across Yukon and a leader in Northern communities, health programs, and in community engagement. A Southern Shoshone matriarch and a member of the Kluane First Nation, her leadership is informed by her heritage and a Bachelor's of Commerce from the University of Victoria. As former chief of Kluane First Nation, she championed energy independence and economic resilience. Mathia, the floor is all yours.
It's always weird listening to your bio. So Dunje, I'm G Medea. I am zooming in from the traditional territory of the Algonquin, and I'm in Ottawa. I'm not sure. I should know this. I hear it all the time. But yes, we are who we are. One Yukon we spun out of the organization or the work that we did during the pandemic. So Carrie Justine and myself were kind of the core team who developed and assisted First Nations in COVID response. We were that go-between between First Nation governments, municipalities, and communities and other levels of government. And we were really focused on how do we take care of our communities? How do we bring the voice of our communities to political decision making? And then in 2023, after the pandemic was declared kind of over, we spun all of the work that we were doing into a nonprofit agency, which is One Yukon Coalition, and really kind of formalize the work that is so important to create that voice or bring that voice forward to governing bodies of what our communities need. And the expansion of the wastewater monitoring program was just one of those pieces. So Carrie was key in developing the wastewater monitoring program in Haines Junction in conjunction with led by Champagne and Ajax First Nation, but in conjunction with the municipality of Haines Junction. And that kind of escalated into the work with City of Whitehorse and the wastewater monitoring program there. This has all been done in partnership with the Public Health Agency of Canada, the National Microbiology Lab, and with the support of Government of Yukon. So it's been exciting, and I really have to give big kudos to the staff that have carried forward the vision of Carrie and I, roping everyone in to look at how do we translate wastewater into health action. So our current board of directors is Carrie Johnston and myself. Allison Perrin, who is a researcher at Yukon University and has been involved in research projects with us. Amanda Johnston is from the community of Watson Lake and is a Casca Nation member. The very famous Jerry Lee Bike is from the community of Mayo, so the First Nation of Machonayak Dun, and has been working in the health field as well. Our team that works in the office is Carolina Koutras, we describe her as our unicorn, because she's able to translate our vision into action. And she has an amazing background, amazing experience. Sherry Wabiska, who's our program officer, who really is that bridge between First Nation communities, municipalities, and our office, and really around building those relationships. Mohammed Karbosh is our epidemiologist, and we have the fortune of having two epidemiologists working with us. So Justine Amon is the other epidemiologist that's working with us, and we have Dr. James Brooks, who's our medical advisor. And we're not saying he's our chief medical advisor, but he is our medical advisor. So what we do, when you think of wastewater monitoring and the other work that we were doing around distribution of point of care test or rapid testing, that is really creating that readiness for public health emergencies. We want to make sure that the voice of our communities are clear, that they have a mechanism to be heard in decision-making halls and at decision-making tables. And that really is around information sharing. And what does information sharing look like? Well, through the wastewater monitoring program, we do a lot of data collection, and that data is governed, or it is actually controlled under the principles of OCAP. So First Nations have the decision-making authority over the data and how it gets shared. And there's a bunch of mechanisms that we formalize around the data collection and the sharing of that information. And all of that is to say that the underlying foundation or the underlying activities that we're doing is really about empowering communities to look after their own health. Because when you see what's in the wastewater, you can determine what kind of health response is required. And once you see and you know what is there, being able to take care of yourself and take care of your families is so much easier, because if we can give you that information and empower you with the tools to take care of your own health, whether that is the technologies such as point of care tests or self-test, rapid tests, or just providing masks if there's a respiratory outbreak. Those types of things are really foundational to building transformative change in our healthcare system. And I think there's another piece that long-term vision for us is really supporting the technical expertise, the scientific technical expertise that is required in our communities to really be a part of this health system transformation that we're facing in the Yukon. So I don't know if that This phrase that we've been seeing for quite a few years really came out and became very apparent during the pandemic. The phrase "nothing about us without us." We really realized that we have to take the voice of community, and in order to not just take it as anecdotal information, we have to generate useful information, useful data that can make informed decisions or science-backed decisions. So the wastewater monitoring program really is about building integrative monitoring structures so that we can have science-backed information that guides healthcare decision-making in our communities. Yes. Working through the pandemic, we really saw that there was a disproportionate effect on our Indigenous communities with COVID and the COVID response. So these stats were from a presentation that was developed out of some research that we did. And it really highlights the disproportionate effect. And from that, we really had to kind of echo or emphasize the fact that Indigenous people, our communities, our First Nation people really have to have a larger voice and be able to change how health response is created in our territory. So this piece around community level data, we know that the current health system in the territory does not track specific identifier information. What we were really hoping that we'd be able to do with the wastewater, and what's proving successful, is being able to collect information that is non-stigmatizing because it's non-identifiable. We don't have to report on it because it's not under HIPAA, it's not governed by HIPAA. And it allows you to get a kind of a bird's eye view of what the overall health is in a region, in a territory. And that can inform health response. So this, I think the power of, we're calling it the power of poo, is really powerful for the rest of Indigenous communities to really look at how to create health response. And how do we overcome all of these really systemic barriers to healthcare? Because people don't want to go to the healthcare office, or they don't want to seek care, but they may be ill. And I think this is where the power of unidentifiable monitoring is extremely helpful for us in creating health equity. So who is taking over wastewater? You're on mute.
Do you have any other points before I take over, Mathia?
No, I think us just sharing the experience of what Yukon has done with the wastewater and just how we can take care of our communities is going to be a lesson or an example for other communities to emulate. If we can just share those best practices across the territory, across Turtle Island, I think that will be one step in reducing those barriers for our Indigenous communities. Thank you.
100%. And thank you so much for taking the time. I know you're actually at a conference right now, so thank you for carving a little bit of time out of your day to come and speak with us. Kind of moving on to our next chunk, we're going to be talking about wastewater monitoring. First things first, for anybody who is unaware, wastewater monitoring or wastewater-based monitoring is an epidemiological approach based on the analysis of wastewater, and it generates information on human populations on a community scale. It's important to note that processes and analysis of wastewater have been used since the 1940s, monitoring different targets ranging from pharmaceuticals, licit and illicit substances, pathogens, and regulated substances such as alcohol and tobacco. The process of wastewater monitoring starts with a catchment population. These are the toilets, sinks, dishwashers, and any other method in which water goes down the drain into the infrastructure below. Commercial and residential buildings, hospitals, schools, and other community facilities are common input locations, and the input contains biomarkers that can reflect a community's health. After flowing through the pipe systems, community wastewater combines at lift stations or wastewater treatment plants. After sampling the pooled wastewater, different technologies are used to analyze desired targets present. For example, it's not showing, but chemical-based detection methods can quantify and or identify chemicals in the wastewater based on their structural properties. These methods include mass spectrometry and are used to detect things like illicit substances or substances of potential abuse, for example. Additionally, genetic material-based detection methods, they provide quantification of genetic material from pathogens or groups of pathogens in the sample. Real-time quantitative polymerase chain reaction, or RT-qPCR, is an example of this, and it's what we commonly use for the detection of respiratory viruses. The beauty of wastewater is that the data collected is anonymous and passive. Everybody poops. So this allows for the status of public health concerns to be determined without relying on clinical data or risking individual stigmatization. Overall, the data collected using wastewater monitoring can help communities through warning, strategy, and monitoring. Using these technologies, we can monitor the prevalence of respiratory viruses, substances, or other analytes of interest in the community efficiently. By detecting these pathogens in wastewater, we can identify outbreaks early, even before clinical cases become apparent, or highlight hotspots of substance abuse to ensure appropriate public health response and resource allocation. This gives a significant advantage in responding to and managing public health threats. It is not good. Sorry, we're having a little bit of technical difficulties. So imagine a slide here, but essentially it has a picture of a machine called a GeneX machine. It is a mini lab, and in Yukon, where wastewater monitoring is taking place, we need to kind of understand how it's taking place. So for the first option we have is a GeneXpert, which is not pictured here for some reason, but it's a molecular diagnostic platform that's used in tandem with an autosampler that allows us to detect different respiratory viruses in wastewater. It's a high-tech machine, and it's currently in use in Yukon community with continuous monitoring efforts in place. So this machine works by using PCR technology, allowing for highly accurate and timely results while being relatively user-friendly and making it ideal for rapid wastewater testing in settings where there's capacity for a mini lab setup. So capacity in this case refers to the need for a physical space and certified operators to ensure quality sampling. In our Haines Junction mini lab, our operators are provided by Donix Water Services, a local Indigenous-owned company who we work with to ensure the highest quality of sampling and reporting. The process, sorry, the images aren't showing, is quite straightforward, but essentially we use an autosampler, which is a device designed to automatically collect wastewater samples at set intervals, and it allows us to get representative samples from the wastewater system and provides with continuous comprehensive data. Once collected, the samples are processed by the operators. The sample then is loaded into a GeneXpert cartridge, and the cartridge is preloaded with reagents necessary for the PCR process, and the machine itself detects and amplifies specific genetic material of SARS-CoV-2 or COVID-19, RSV, and flu. Just so you know, these are not the only things that we can test with this machine. We also could expand the cartridges to include things like STBBIs, substances, or other analytes of interest. The results from these are provided within the hour and converted to usable variables, which are presented on our dashboard, which will be discussed shortly. So in addition to the GeneXpert, imagine an image here of basically a lab in a box. This lab in a box is by Kraken Sense, and it's a fully autonomous portable laboratory that uses advanced sensor technology and AI to perform rapid on-site testing Essentially, it's a cutting-edge compact system that was designed with ease of use in mind. So it's a great fit for communities with limited wastewater infrastructure or capacity to initiate a wastewater program. The process works very similarly. It starts with a built-in auto sampler that takes predetermined samples at predetermined intervals. The samples are then processed internally. The samples are analyzed using advanced biosensors and real-time PCR technology to detect and quantify the genetic material present. And then the results are generated and automatically given to a central database that can be viewed by our team and translated into our own database program. Together, the GeneX and the Kraken Sense, which I wish I could have shown you here, they allow communities to choose a viable option for wastewater monitoring that suits their needs. Essentially, these technologies exemplify how One Yukon is using technological advancements to empower individuals with the data needed to improve community health outcomes. Next, we are moving on to our data dashboard, which is, if we have all this data, where are we presenting it? As I mentioned earlier, the data from Kraken Sense and our Gene Expert go to our data dashboard, and using some of, oh, this is the end of the presentation. Oh dear, we're having technical issues. Just 1 second. I'm going to try to. Perfect. We should have done this sooner. So we actually have access to the slides again. Perfect. So looking at the GeneX machine and the Kraken Sense, this is what they look like. Sorry about that. Essentially, one is a lab in a box right here with the Kraken Sense. And then the Gene Expert, we have a mini lab set up where it can be part of a more a lab-like experience. Is basically a mini lab. We also just this slide disappeared, but we at One Yukon, we've signed actually wastewater-based monitoring agreements with 9 different Yukon First Nations, municipalities, and the Yukon government. And you can see the little X's represented on that map there, that we have a significant amount of participation, and we are having we have active communication with a number of other communities to ensure that we can provide the services should they wish. So moving forward into the data dashboard. So the data comes from the Kraken Sense and the Gene Expert, and we have to present it somehow. So I'm going to use an example from Haines Junction to walk you through our current data dashboard. So once you have access to this dashboard, the first thing that you're going to notice is a large graph with a significant amount of data points. This shows the 7-day moving average and the SARS-CoV-2 or COVID viral load detected across the sample dates. This creates opportunity for you to see how the current data points stack up against historical trends. Looking back at the top, we have one of the coolest features, and this brings the information about current levels and trends of various respiratory pathogens to Yukoners. The methods that are used are adapted from the Public Health Agency of Canada's methods, but use a 4 scale from very low to high instead of a 3 scale of low to high. And because of this, the results on the dashboard shouldn't be direct or aren't directly comparable to and shouldn't be compared with the results in the National Wastewater Dashboard. But you can see that highlighted, the current signal and trend level are color-coded based on their status. This system provides a quick and clear picture of the current respiratory viruses in the wastewater, and it can be easily viewed and interpreted by community members. Should any questions arise while you're using our dashboard, the FAQ page has really in-depth explanations on how, for example, our low, very low, low, and moderate viral levels are defined, as well as information on the data collection and the analysis. This is just a quick snippet, and I welcome you to visit our website to see more. So one important thing we always like to do is ask why. Why are we collecting the data? Who is it serving? And how can we make sure it's valuable? These news and social media clippings are just a small example of how wastewater data, when presented in a meaningful way, can empower positive community outcomes. Communities and individuals are able to use the data provided to make informed health decisions. While these examples are specifically from the COVID era, having the data dashboard available beyond respiratory viruses will increase the availability of meaningful Yukon First Nations data, impact positive policy change, and will be able to support individuals in their health and wellness. Shifting gears into the next topic, we'll be discussing the use of wastewater monitoring for substances. Providing a brief overview and timeline of substance use and abuse in the Yukon, we can see that on January 20th, 2022, the government of Yukon declared a substance use health emergency in response to rising addiction and overdose rates. Since this time, there's been a number of strategies and responses targeting this issue while it continues to persist. By understanding this history, we can better appreciate the progress made and the work still needed to be done to address the substance use emergency in Yukon. So where are we at today? We know that Yukon leads Canada in per capita overdose rates. The death rate due to substance use in Yukon is nearly 3 times that of British Columbia. And we know that Indigenous communities are disproportionately affected by this crisis, experiencing higher rates of substance-related harm, including death. So this is all very heavy and feels like a lot to tackle. So we have to ask ourselves, what can we do? And I think the words of our CEO, Mathia, say it best. We can use wastewater monitoring as a weapon to stop opioid deaths. Building on the lessons learned from our COVID journey, One Yukon can take important action to deliver tools and systems that can respond to this crisis. So wastewater-based monitoring is used around the world as a cost-effective tool to detect, understand, and act against patterns of substances of potential abuse, or SOPAs, at the population level. With limited community data available on SOPAs in the Yukon, wastewater-based monitoring could effectively capture pooled community data on SOPAs without relying on voluntary disclosure of sensitive or stigmatizing information. The application of wastewater-based monitoring of SOPAs is vast and can include the identification of community drug profiles, analysis of temporal and spatial trends, and act as an early warning system of contaminated and emerging drugs of concern. The information gathered also may aid to fill the gaps in data availability on SOPA use in Indigenous communities to combat the current public health crisis and opioid epidemic. Most importantly, data only reflects use within a community, and with data use safeguards in place, individuals are not targeted and privacy is respected and maintained. One way that One Yukon is providing this information is through a collaboration with the Advancing Canadian Water Assets, or AQUA Lab, with the University of Calgary. AQUA is able to provide quantitative substance and biomarker analysis. And you can see the chart here shows the analytes that this program can detect, allowing for participating communities to track their presence of toxic drugs, for example, fentanyl, in their wastewater. Having this knowledge can empower individuals to take care of one another, as well as to drive public health action, such as tailored and culturally appropriate community interventions. So while there's so much more that we could talk about regarding SOPAs and substance use, our next topic we have to spend a bit of time on is STBBIs. So firstly, STBBIs, it stands for sexually transmitted and bloodborne infections. This can include HIV, chlamydia, gonorrhea, and other STIs. Today, we'll be highlighting syphilis. So syphilis is a highly infectious infection that can have long-term health outcomes if left untreated. The treatment involves an appropriate prescription of antibiotics, generally penicillin. Determining the status of STBBIs and syphilis in Yukon and the burden on Yukon First Nations is difficult and evolving because there's a presence of a syndemic. This is where interconnected health issues compound each other, leading to worsening health outcomes. For example, the health crisis, existing health conditions, social disparities, and economic disparities. What we do know is that from recent reports, 54% of syphilis cases in the Yukon are in women and 46% in men, 46%, and that the rates were highest among those aged 20 to 39. The blurred out chart on the bottom right indicates that the data available only paints a part of the picture. There are gaps in the data where community members are unaware and don't have the ability or the knowledge to create and make informed decisions about their health. Remembering that the rates of syphilis are higher in women than men in the Yukon, this raises concerns for an increase of congenital syphilis, which occurs when the infection is transmitted from mother to baby during pregnancy, potentially leading to severe health issues for newborns, including stillbirth. Looking into history, it looks like the 2023 infection rate for syphilis in the Yukon is 26 times higher than the 2019 rate, and it's the highest it's been since 1979. Building on this, we can also see that although there is data available from 2023 on the rates of syphilis in Yukon, there is no information available on the overall climate of STBBI testing. Not knowing the number of serology specimens completed in the territory may cloud the data. For example, are we getting more infections because of increased testing regimens, or is the number of infections increasing independent from the number of tests completed, indicating an even bigger problem? Indigenous communities face significant health disparities, particularly with high rates of STBBIs. These also include HIV, hepatitis C, and in Canada, new HIV infections are overrepresented in Indigenous people, with an estimated 15.2 new infections per 100,000, compared to an estimated 4 new infections per every 100,000 Canadians. Knowing this and building on the successful implementation of infectious disease education, monitoring, and evaluation during the COVID-19 pandemic, One Yukon aims to extend this model to monitor STBBIs. So this is where point-of-care testing comes in. Point-of-care tests are diagnostic testing that is performed near or at the site of the patient, and it provides speedy results for near immediate medical decision-making. This test specifically is the Instant Multiplex HIV 1 and 2 syphilis antibody test. It's the first point-of-care test in Canada approved for dual HIV syphilis, and the first for syphilis at all. Approved by Health Canada to be administered by healthcare professionals, it requires just a lance and a small amount of blood. It indicates reactive or non-reactive within minutes, and it requires serology confirmation, so blood work. There are a number of advantages to using point-of-care testing to address the rise in syphilis cases. These include, but are not limited to, having access to immediate results, increased patient engagement and follow-up, as well as the test, treat, and connect framework that ensures folks receive treatment immediately instead of having to make return trips to receive health care. This makes it ideally suited for northern, remote, and isolated communities. Point-of-care testing also reduces reliance on traditional laboratory services. It's easy to administer and has size sensitivity and specificity, ensuring high-quality, time-sensitive care. As point-of-care testing increases in popularity across the country and across the globe, One Yukon is currently providing feedback to the Canadian Public Health Laboratory Network, specifically the point-of-care testing working group. This working group seeks to provide regulatory guidelines for the continued application of point-of-care testing across Canada. And we participate in the editing and drafting process, which ensures that the use and distribution of these tests continue to consider the populations that they serve, emphasizing the importance of these tests in northern, remote, and isolated areas, improving healthcare accessibility. So what are the expected outcomes of point-of-care tests and integrated education in the Yukon? Well, these include increased detection and timely treatment, reduction in transmission rates with increased infection awareness, and overall improvement to sexual health outcomes in the Yukon Territory. One Yukon is currently seeking new and supports existing efforts made with healthcare providers, government, and community organizations to get these tests distributed, and have had the opportunity to purchase 5,000 tests, which are ready to distribute. Last but certainly not least, we're going to spend a couple moments speaking about the importance of community engagement at One Yukon. So knowledge translation and dissemination are crucial for One Yukon to ensure that the latest public health information, research, and opportunities are shared with stakeholders to continuously improve health outcomes. A few examples of that is Ask Auntie. It's an online community resource designed to empower all Yukoners to explore their health. It's anonymous, culturally safe, and incredibly helpful. So whether you have questions about sexual health, vaccines, or health resources, Ask Auntie is there. It's available 24 hours a day, 7 days a week, and it's a free service that promotes health and wellness, but providing reliable information at your fingertips. As you can see, there's a phone number there if you want to note it down. Next, Indigenous approaches to public health. Lessons learned from the Yukon First Nations responses to the COVID-19 pandemic is a research paper that outlines the key contextual elements that are needed to understand jurisdictional complexities at the center of Yukon's COVID-19 pandemic response. Last year, we have Parents Like Us, which is an unofficial survival guide to parenting a young person with a substance use disorder. This was written by parents for parents and was modified in March 2024 to include Yukon resources. All of these and more can be found on our website. In addition to resource provision, our programs are guided by community. There's nothing for you without you, and this includes the decision to fund or investigate different targets within your community. We have seen interest range from syphilis and other STBBIs, TB, polio, antimicrobial resistance, substances of potential abuse, and more. This interest and feedback from each and every one of you helps us to guide the direction of One Yukon. In this, we also prioritize sustainable connections and interventions that will allow for long-term support and advocacy, leading to an overall shift in the collective health of those we serve. Knowing that we're guided by community is one thing, but how can you connect with us? One Yukon has maximized connection options to ensure that we reach folks where they're at. We have a weekly newsletter, our data dashboard, we're on Facebook, Instagram, LinkedIn, and Twitter. We also have a great website, and we can be contacted by phone, email, or mail. Our social media handles and information on how to reach us will be available on the final slide today if you want to note it down. In conclusion, I do hope that today's webinar taught you a few things and provided you with an introduction or a better idea of what One Yukon is and what we do. I also hope that it left you with the importance of using advanced technologies like wastewater monitoring and point of care testing to enhance early detection and response to health threats and empowering communities. The importance of knowledge translation and dissemination as a catalyst for tackling public health challenges and equipping community members with the latest research, and also the importance and the role of community and of community engagement to address and determine issues of public health concern. I'd like to open the floor for questions. You can type your question into the Q&A box so I can address it as it comes in, or if you would be more comfortable, you are welcome to contact us at any of our social media, which will be on the platform, or at the slide next slide, and reach out to us there after you've had a bit of time to digest. And if you have any questions about our programming, getting involved, anything like that. So I'll leave the floor open just for a minute or two, in case anybody has any questions. Sorry about the technical issues. That's very unfortunate.
And Justine, we had a few submitted questions in advance of the webinar that are on the chat as well.
Perfect. Let's try to find the chat here. Okay, so there's a couple questions here. Looks like I might be able to answer most of them. If you do submit a question in the meantime, I can switch my focus over there. For now, this question is, are there plans to expand the wastewater-based monitoring program to monitor additional substances or pathogens in the future? So yes, there are plans, specifically active plans in the realm of substances of potential abuse, or SOPAs. We are actively participating with Aqualab and the University of Calgary to analyze substances within wastewater samples in one of our communities, and are going to be working to kind of digest those results and see what kind of action we can take from those. This actually really reflects well the question in the chat here. What are the substance targets for substance use? If I can actually go back, I will pull up the chart again. But there are 48 different analytes on this list. We've got, so the main chart that comes off of it, but it's substances of potential abuse. We have amphetamines, fentanyls, cocaine, other opiates. There's a miscellaneous section, as well as benzodiazepines, psychedelics, alcohol, and nicotine. And then within those categories, there are metabolite that are also being analyzed. So there's quite a wide variety of substances that are being tested in this pilot here, and can be also edited at the comfort of the community as well. So Sarah, the question about the point of care syphilis testing, has it been put into action yet? So it has not yet. We have access to the point of care test kits, and the Health Canada has just approved them for professional use. And we're working with community and local government and municipalities to ensure distribution and use, hopefully in a very short time period. So that'll have to be an update in the coming quarter. So for the substances of abuse, how are you going about assuring the detection of an analyte is for illicit and not legitimate use? So this covers both licit and illicit substances, and a large proportion of them can be consumed for both set reasons, prescribed reasons, and for non-prescribed reasons. So we're not able to determine the context of usage. However, we're able to highlight whether it's present in a sample, and especially when we're talking about substances that are particularly harming. There are some like benzodiazepines that don't respond to Narcan. So making sure that if something like that is present within a community, we can give heads up to the appropriate folks and ensure that there is resources going where they need to go and appropriate public health response. Carolina?
Yes, that's great. And just to add on this question, I think one important thing to highlight is that as part of this collaboration with Aqua, we are quantifying these substances. And obviously this is, this is kind of a unique type of project. There hasn't been a lot of wastewater monitoring for SOPAs, but we're trying to kind of build and understand the baseline for that community, really looking at the different substances and their metabolites, and as well as exploring the best biomarkers. So while it's not possible to fully determine is it like recreational illicit, it really like you have to look at the full picture and build that baseline to really understand what may be happening. And the other thing that we're really big tying to looking at the substances is always bringing the context. What's happening in terms of seizures. Yukon is unique that it's just the bordering BC and Alaska. So are there anything new that's being introduced there wasn't here before? In medications there are typical for medical use, but are we seeing any signs that it may be using for manufacturing of other drugs that are toxic? So it's a lot of like being able to quantify is really fantastic, but also always bringing that context and just give us time to build that baseline for the communities that are participating in the program.
No, that's a really great point, and especially the point about looking at geographically where we're located. If we notice on some sort of in a drug monitoring programming in a neighboring province, or in the States, in Alaska perhaps, that they're seeing the emergence of a new substance of concern, that's something that we can keep our eyes open for, and see if it's following the geographic kind of movement of people through Yukon, from the States into the States back into Alaska. So there's a whole variety of ways that this data can be used, and we are just at the beginning of it, and hope that other communities, should they see this be something of use, would feel comfortable in reaching out and discussing the options for making this happen. I'm just going to pop back to the other chat. So we have a couple other questions. So let's see here. How do you establish and maintain collaborative agreements with First Nations and municipalities? That's a great question. I am not a huge part of that process, but maybe Carolina, you could speak to that. And I know you and Sherry, our program manager, are huge parts of making connection and maintaining these agreements and these MOUs with municipalities and with First Nations.
Yeah, so that was on the establishing and maintaining the collaboration with community. Yeah, that is a great question. I think in many ways, I don't know if lucky is the word, but I think we've had really great collaboration so far with communities and municipalities and Yukon government. Our approach is always to go in and create a space to listen and understand the needs of communities. For that reason, even our program has already evolved. So, for example, we brought in the Kraken Sense because for some of the communities, they really wanted to be part of it, of the program, but they just didn't have the capacity to have a local mini lab. Or other communities, they actually want to build that capacity and create local jobs. So listening is really the first thing we go in to see if it makes sense. And then from there on is just bringing together the community, municipality, and see how can we work together. How can we have an agreement where the elements of around data that need to be incorporated. And so we've done that for the few jurisdictions that we worked with, and now we kind of have a good model that we just have been replicating it as we expand. Sometimes you have to go in and tweak a little bit, but I think it's just going in, creating that space to listen and understand the priorities. And to be honest, it could be for some communities right now, this is just they're interested, but it's not a priority because there's a lot going on in the territory. So knowing when is the right time and going from there. I think there's been a lot of work on these agreements. We also were able to develop a larger data sharing agreement that also includes the Public Health Agency of Canada. It's all aligned with OCAP. So I think the communities recognize that we do have their best interests as part of these agreements. Again, it has been very successful. And I think it's just been that approach to listen and not try to just impose a program. The other thing that we're very careful about is also making sure that we'll be sustainable. The last thing we want to do is to go in, implement a program and not have any sustainability in the future. So we do have still a couple of communities and municipalities that we're still working on. There are also geographical challenges with the territory that I have to mention. It might not be obvious if you're not in the territory, but working with communities during the winter, if they are more remote, is challenging because most of these relationships that you really build them in person. So then you kind of have to pick up work again right now, spring, summer. So there's just all of these things that are unique to the territory to be aware of. But we're also very lucky with our board. We have a really good representation from First Nation communities from across the territory. And it has been incredibly helpful, building on the foundational work from Carrie and Mathia. I think most of the communities had already heard from the program and were really interested and curious about, okay, how could they engage with us in some sort of way? Yeah.
No, that's perfect. That's a perfect explanation. And you already sort of started to touch on it, but the work that we do wouldn't be possible without, the collaboration with the communities, the municipalities, the First Nations, government bodies, also different funders and collaborators, which I put up on the screen here. It is essential that we receive this support, from an expertise point of view, also from a longevity point of view. We want to make sure that these programs start and continue for a long period of time. And folks like, the Council of Yukon First Nations, Public Health Agency of Canada, the National Microbiology Lab, ISC, or Indigenous Services Canada, Yukon Government, University of Calgary, and the Aqua Lab, Reach Nexus, and Science of First. These folks are, we're very lucky to have them as founders and collaborators, and incredibly lucky to have all the signatories on the left-hand side, all the First Nations and municipalities that have taken to the idea of wastewater-based monitoring and implementing different measures for controlling STBBIs and SOPAs within communities. So we're just very grateful to have those opportunities here.
Yes, and if I just can expand quickly on, so the collaboration with the National Microbiology Laboratory, that's actually a really important point. We hear that over and over whenever we go to a council meeting or joint council meeting to present on the program. I think it's very clear that it's important for them that we are working with good labs to look at the data. And there's a lot of expertise backing our methods. So that has been a really good collaboration and support from them, and we really hope that we'll continue to receive support from them in the future as well.
I think we just have one more question pop up, and then we'll wrap it up for the hour. Are you going to implement any model or analysis to identify the drivers of water contamination? Rohit, do you mean like freshwater contamination, or because we do take wastewater samples which are already polluted by all the kind of input that comes into that, but modeling and analyzing perhaps where SOPAs are coming from, the substances of potential abuse, might be possible when you combine things like clinical data, like prescription rates, statistics on alcohol and smoking use. Kind of the possibilities are endless, and it all depends on what the community is looking for and how the data being analyzed and modeled would be helpful to them. Carolina?
Yes, and just very quickly, so in addition to kind of the ability to kind of triangulate data from like the wastewater, I think it's very clear to us as well, like from a lot of feedback that we have, we've been having discussions with experts working with water contamination as well. And I think that whole relationship of like water, wastewater, and the environment is just really important to understand health. There's a lot of activity in the territory, like mining, all sorts of activities that could contaminate water as well. And so we are actively looking into how we can expand the program to look at water contamination as well, and just that kind of environmental drivers that may impact individual health in communities.
That's awesome. So we are almost perfectly on time. So I'm just gonna go to this final slide here. And it's just, if you'd like to connect with us, we're available. If you look us up, One Yukon on Facebook, Instagram, Twitter, or X, and LinkedIn. We're also, like I said, available by phone, email, and by mail. I also will be emailing out a feedback link after the webinar closes to all registered participants in order to get a bit of feedback. This is kind of a learning experience for us, and we're hoping to take away some input from community members, stakeholders, everyone who attended today to do better in the future. So thank you so much for everyone for attending. I think we will cut it here, and I hope you have a wonderful rest of your evenings, afternoons, or days, depending on where you're joining us from. Thank you so much, everybody.